Post-traumatic stress disorder. What is PTSD? PTSD stands for post-traumatic stress disorder, a mental health disorder involving shocking and scary events. PTSD is a psychiatric disorder commonly developed in individuals that suffer from stressful events. Getting afraid is natural for a person that suffers from PTSD attacks and suffering from complex PTSD. People with PTSD issue often develop feelings of isolation and guilt, which reduces the productivity of living. An average person can get PTSD due to serious life issues and stressful situations. Different people have different levels of PTSD disorder based on their mind and body position. What are PTSD symptoms? Every individual has different PTSD symptoms based on their experiences and level of PTSD issue. Some common symptoms of PTSD are 1. Attentiveness or feeling on edge. 2. Circumventing memories and feeling. 3. Difficult opinions or belief. 4. Developing negative changes in moods. 5. Feelings of emotional and physical reactions. 6. Emotional shocking or avoidance. 7. Hyperarousal. 8. Negative thinking. These PTSD symptoms develop feelings of trauma happening as vivid flashbacks, nightmares, disturbing thoughts, or intense distress. Some physical symptoms are physical pain, nausea, sweating, or trembling. These are the most common feelings faced by individuals with PTSD issues, and each has a different impact on humans. Majority of the people with PTSD issue are not aware of symptoms, which increases the chances of severity. PTSD problem increases the chances of developing other physical and mental health issues among people and reduces the productivity of human life. Individuals with the issue hold weak workplace productivity and even face a relationship breakdown. What are causes of PTSD? Post-traumatic stress disorder has a large number of causes that are 1. Sexual or physical abuse. 2. Severe accidents. 3. Childhood and domestic abuse. 4. Serious physical health issues. 5. Violence. 6. Direct exposure to traumatic issues. 7. Physical assault or bullying. These are the most common cause of PTSD that impacts human in a negative way and reduces their chances of success in life. These causes are commonly involved in developing mental health issues. Some other causes that might have a lesser impact on developing PTSD are racism, sexism, natural disasters like earthquakes or fires, and the death of loved ones. People suffering from these scenarios develop feelings of helplessness and horror. It is important for people to analyze their behavior to stay on track with their mental and physical health and adopt the right strategies. Treatments of PTSD. There are two most effective treatments of PTSD disorder which are found effective and productive for all patients. These treatments are 1. Psychological therapies. 2. Medications for PTSD. Psychological therapy is the most effective and impactful treatment method for PTSD issues among people, and it derives positive changes in the behavior of people. Psychologists prefer to use different psychological therapies as their foremost treatment for PTSD problem. The use of therapy to treat PTSD problems offers highly significant responses and improved outcomes. Cognitive behavioral therapy provides highly effective results for treating PTSD problems among people. It enables the chances of a quick recovery and better experience for the people. PTSD and cognitive behavioral therapy validate the treatment among patients and help them overcome stressful situations. Medications are also used to treat patients with PTSD problems, but these are considered less effective as compared to psychological therapies. However, psychologists suggest PTSD medications to patients on their demand or to those who reject psychological therapy as a treatment option. Psychologists can suggest the best medication for PTSD patients to improve their health conditions. CBT for PTSD is the most effective treatment method which offers quick recovery. Best treatment for PTSD. Cognitive behavioral therapy, CBT, is considered the most effective treatment for PTSD issues in most patients. It has a positive treatment response for complex PTSD problems among patients as it improves the mental health of patients. It is the best therapy for PTSD treatment and offers highly significant results to patients with PTSD flashbacks. Patients' consent is considered important while deciding on the best treatment for PTSD because their consent plays a key role in motivating them while receiving the PTSD treatment process. Some other therapies to treat PTSD are eye movement desensitization and reprocessing, stress inoculation training, prolonged exposure therapy, PTSD trust issues. Patient with PTSD problem often struggles with trust issues at home and at the workplace, which impacts their relationships and professional career. PTSD and employment problems together can bring further negativity among patients and demotivate them while at the workplace. It is highly important to focus on the guidance provided by psychologists to overcome the trust issue. The process will help in organizing the activities and managing the issues while at the workplace. Trust issues are commonly caused by the symptoms of PTSD. These trust issues harm relationships and produce negative behavior among people.